Good morning. Being 9 a.m., I'll call to order the McHenry County Board Committee of the Whole meeting of April 11th, 2024. Ms. Von Bergen will lead us in the pledge today.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, Kathy, could you call the roll, please?
Joseph Gottemoller. Terry Greeno. Here. Eric Hendricks. Carl Kaminsky.
Present.
James Kearns. Matthew Kunkel. Here. Teresa Meshes. Lou Ness. Here. John Reinhardt.
Here.
Brian Sager.
Here.
Michael Shorten.
Here.
Michael Scala.
Present.
Larry Smith.
Here.
Gloria Van Hoff. Tracy Von Bergen. Kelly Wagner. Here. Chairman Bueller.
Here. Okay, having a quorum, I'll entertain a motion to allow Mr. Hendricks to attend remotely. Ms. Altoff makes the motion. Ms. Greeno seconds. All in favor say aye.
Aye.
Against, welcome Mr. Shorten. Good morning. I have several items to share with the board before we begin reviewing the agenda for next Tuesday's voting meeting. The Regional Planning Commission held its last meeting on March 28th to complete its draft of the 2050 McHenry County Comprehensive Plan. The commission is now in the process of putting the draft plan up for public review and is scheduling an open house and public hearing in May. I'd also like to thank the commission members and especially Chairwoman Mary Donner for all their hard work and time over the past 2 years. On Monday, April 1st, I had the pleasure of speaking at the groundbreaking for Taylor Place Apartments, the project which the county board wisely helped launch with an $800,000 advanced McHenry County grant will add 50 new workforce housing units in the city of McHenry. It took us 3 years of working with state and federal agencies to get here, and I hope that future efforts to build workforce housing in McHenry County can be streamlined as the need continues to grow. I'd like to thank Hans Mock and our Community Development Division for all their work to get us here, and thank you as well to Congressman Bill Foster, who attended the groundbreaking and who has prepared a statement praising McHenry County Community Development Week and the Taylor Place project to be read into the congressional record. Thank you as well to County Board members Kelly Wagner, Carolyn Campbell, Tracy Von Bergen, Carl Kaminsky, Pam Altoff, and Lou Ness for joining me at the event. Speaking of Ms. Ness and Mr. Kaminsky, congratulations to both of them for putting together the lovely event on March 29th right here at the County Administration Building to honor Vietnam Veterans Day. I heard that turnout exceeded their expectations, much like their Veterans Day observance last November. The County Board is blessed to have two Armed Forces veterans who work together to honor their fellow men and women in uniform. And they also help raise awareness of their needs and help raise awareness among veterans of the many benefits that exist to assist them. Last week, I had the honor of attending the McHenry County Division of Transportation open house regarding potential safety improvements to the intersection of Charles and Queen Anne Roads north of Woodstock. In recent weeks, the DOT has been doing a yeoman's job informing the public and soliciting input for future improvements prior to the Charles Road open house. The DOT officials held another event to discuss improvements to Lakewood Road in Lake in the Hills. Not to be outdone, Metro held an open house March 21st at the Woodstock Opera House to discuss the proposed Woodstock rail yard. This event too was well attended and was very informative regarding this important project. The McHenry County Department of Health is holding its 5th annual Operation Dropbox event. The Health Department partners with county businesses, churches, libraries, and civic organizations to house drop boxes in which people can donate goods to Veterans Path to Hope, a charity which assists homeless and at-risk veterans. Last year, Operation Dropbox collected 5,466 pounds of donated goods that supported more than 3,000 county veterans and their families. Local organizations that would like to host a Dropbox have until tomorrow, April 12th, to sign up, and they can do so by calling 815-334-4500. And finally, this morning, I'd like to remind county board members that the deadline to file your annual statements of economic interest with the county clerk and recorder's office is Wednesday, May 1st. That concludes my remarks, and with that, Ms. Melissa Adamson, the Board of Health President Joe Clark, will join us with an overview of the Department of Health's annual report to discuss all things that the Health Department does. But first, we will have members' comments. Do any members have comments today? Mr. Gottemoller?
Yes, thank you. I know, I appreciate all the work that the Planning Commission did to put the comprehensive plan together. I spent some time in the last week or so looking through it. And I think there's something missing, and I'll explain what I mean in a second here. The purpose of a comprehensive plan is to form the basis of our zoning ordinance. As a matter of fact, under state law, if we do not have a comprehensive plan, our zoning ordinance is actually not enforceable. So looking back at that, then we look at what the plan does. This plan we're about to adopt, or we're going to look at in the next few weeks, is what we're supposed to use for the next 25, 26 years. So before I was on this board, I used to appear regularly in front of the zoning board. And one of the things I did in front of every one of those meetings was to figure out how my client's request was going to fit into the comprehensive plan. So I did that again for this, just to give you an idea of what might come. So in every zoning hearing, you hear the staff and the petitioner argue about whether the comp plan has been met. The petitioner reads it for that purpose. On page 2 of this plan, as they proposed it, they talk, the first 3 things that they talk about is that it frames and communicates a vision to guide McHenry County's future. It provides the foundation for evaluating development proposals, and it establishes the regulatory framework for proposals. That's absolutely true, and that's what a comprehensive plan should be doing. So I looked at this plan and said, so what could I build if I was a developer now? All right, on the very first goal on page 11, our goal is to support an obtainable housing, which sounds wonderful. I mean, I don't know anybody that doesn't want a place to live. And then on page 22, it talks about the vision and themes are abundant, affordable housing, farmland protection, public transportation, and reliable infrastructure. There is only one way for all 4 of those things to happen at the same time, and it's called density. So looking further into the plan, I decided, let's take a project. I'm going to buy 10 acres of land, and I'm going to put 8 units per acre density on them in a conservation design plan. That 10 acres would allow me, under this ordinance, if I did that zoning, to put 80 apartments centered in the middle of this with a septic system around it. It would be conservation design, could be highly dense in the middle and have open space around it. So I'm thinking, where would we put that in McHenry County? Under this current comprehensive plan, we would put it in any crossroads town because purportedly they have infrastructure. That's what the plan says. Yet when I propose that 80 acres of apartments in Alden, I don't know that anybody in Alden would think that was a good idea. And so I looked at some other crossroad communities. There's one that many of us heard about recently off Country Club Road, just north of Ridgefield. Ridgefield is, again, one of the crossroad communities that somebody wanted to put up a sports dome in. If you look at that zoning on that piece of property, it's currently ag, but to the north of it is estate zoning. To the south of it is R1, which is the highest density zoning we've put in the last 20 years. This would qualify for the middle of that. 34 acres at 8 units to an acre. It works out to something in the neighborhood of 240 apartments. They were complaining about a soccer field. I can't even imagine the hue and cry we'd hear with 240 apartments. And yet, if I look at this plan, I can justify that for the following reasons. First off, it's high density, over 8 units to an acre. It's near a neighboring community, Crystal Lake. It is It's infill because it's between two residential subdivisions, and it's across the street from stuff that's industrial, so it would fit right in. In theory, if you give me enough units, I can build my own sewer plant. It happens in Kane County regularly, so that it is something that I can do. And if you give me 240 units, I'd be willing to bet you I could build that sewer plant. That would give me the infrastructure. So, I mean, it's just one example of what we're about to unleash on ourselves. Because if you do this plan as it currently sits, it hasn't given us any room to say no to anything. And I'll give you one more example before we're finished here. We can't say no to solar farms anyway. This plan actually calls for us to be an exporter of energy. We're not going to just be neutral. We're going to get so much energy produced in this county that we're going to export it to other counties. Now, they didn't do any of the numbers for that, but twice in my life I've gotten the audacious job of trying to put power plants up in McHenry County. I lost dramatically both times. It wasn't close. But just to give you an idea of what that means, as a result, I learned a lot of things about power plants along the way. Byron Nuclear Plant produces 1,600 megawatts of power as a base power system. We're using it right now with the lights on in this room. Duke Energy, that we recently approved, is proposing a 300 megawatt plant, or if it ever gets built, is in Riley Township. It is 5 square miles of solar panels. All right, so that's 1/5 of what we need just to replace the base. And that's only going to operate when it's a really bright sunny day, you know, and it's noon. But if we're going to do that, we need 5 of those just to replace the base plant during the time frame. That's 25 square miles of solar panels. To give you an idea, and I looked this up last night on the 2010 census, if you took the city of Crystal Lake and the incorporated areas of the city of Crystal Lake and the incorporated areas of Woodstock, you would just make it. That's how many solar panels you're talking about putting in McHenry County for us to become a net user, not an exporter, a net user of solar panels. So again, we now have a plan that says that's one of our goals, is to become a net user. I don't think that anybody here really thinks that's one of our goals, to put up 25 square miles of solar panels. But that's what we've done to ourselves. If we adopt it in its current form, we have tied our hands for all those projects coming in the future. I think we have to take a good hard look at what we think our plan is. I don't think 8 units to the acres density that we're looking for. And just to give you an idea of what 8 units to an acre looks like, Coventry neighborhood in Crystal Lake is about 3.4 units to an acre. So you could take 4 houses in Coventry, make them into duplexes, and you would then have 8 units to an acre. All right. So you say, well, you know, I want, again, abundable affordable housing is I think on page 43. Abundable affordable housing. You know, I've heard enough about tiny houses on TV. Tiny houses used to be called, you know, trailer parks, because that's what they are. You know, and it's great to say I'm going to put this in my backyard and my kids have a place to hang out. But I don't think we really have a great demand for, you know, that type of housing in McHenry County. And when you talk about having 8 units to an acre, that's what you're talking about building. So it's coming to us as this board to take a good look at it. Please take the time, read it, understand how it's used. It is used to tell us how to make zoning decisions. And when you say that the crossroads communities in McHenry County need infill, you're talking about Alden, you're talking about Ridgefield. I'm not certain that Alden is the place that I could justify, you know, buying 100 acres and putting up 800 apartments. I mean, you're talking about 800 apartments on 100 acres of land. That's really high density. And I don't think you'll find that anywhere in any municipality in McHenry County, period. And not many places in the suburbs at 800 units for 100 acres of land. So at any rate, it's just a warning, a shot across the bow. Guys, you got to read this thing. It's going to come for public hearing. And I think that when you think about what projects can be built with some of the statements in this plan, you might want to think about some revisions. Thank you.
Thank you, Joe. Ms. Greeno?
Yes, first, I cannot neglect to say thank you, Joe, Member Guatemala, for that. That is very, very important. Not only should we be informed, but we should make sure that our constituents are informed so that they can make statements on this. What I wanted to make a comment on was on a much lighter subject, and I just wanted to call out our Chairman Bueller for his articulate comments on Fox News, and thank you for being so articulate as a representative of our county.
Thank you. Mr. Kunkel?
My issue, I'll be the first to admit I don't want to get over my skis here with this because it just came to me this morning. But in light of the fact the Board of Health is here, it's more like a question. We have a lot of food pantries in the county, all working hard. I think that's a fantastic thing. Some of those food pantries are more capable than others as far as meeting their fiduciary needs annually. Others, like this morning, we were in a Cary Grove Rotary meeting. It relies on Rotary members of our group to go and actually hand deliver some of these or transport seniors to our local food pantry. Even members, we have to shovel the sidewalks and salt before they can open some mornings. They're right on the cusp, but they are feeding more people now than they have in the past many, many years. Since the pandemic, it has trended upwards dramatically. And then I found out this morning that we as a health department in McHenry County are inspecting these, which is great. That protects the entire county. But I also found out we're charging them a $175 fee for this inspection. This particular pantry doesn't see that in, they have like a donation jar, and you can imagine how much actually goes into that annually. It probably doesn't make $120 annually. So again, I'm getting over my skis because I don't know exactly how this works. This was pitched to me this morning to bring up to you and my fellow board members to find out how this is actually breaking down. And I realize you can't charge one pantry and not charge another, but I think we do have to take a look at this because these pantries need to be spread out because people can't get to a large centralized location pantry. Thank you.
Thank you. Seeing no further members' comments, we have a couple of public comments today. First will be Leonetta Rizzi. And just a reminder, public comments are limited to 3 minutes, at which time the red light will come on in front of me. If you have not completed your comments, I would ask you to summarize at that time.
Thank you, Chairman. I wasn't planning on making public comment today. I was here for the mental health proclamation, which is on the agenda for next week. But I couldn't resist taking this opportunity to truly thank the chairman, the board, the administration for all the efforts with the sales tax referendum for the mental health board and truly recognizing, you know, through this past year of the needs that we have in this community for mental health, intellectual developmental disabilities, and substance use disorders. So again, I can't thank you all enough for all your efforts in being involved in forums and the education and the personal contribution to signs. It's remarkable that there's a victory here, and again, thank you for all your efforts. I also wanted to take this opportunity, since I'll be here presenting at the COW next month and giving you all an update of where we're at. But I wanted to take the opportunity because we also have our town hall on May 9th. And I would encourage you all, it's 5 p.m. on May 9th at the Mental Health Board. So I would encourage you all, if you can make it, to come to our town hall. That's usually when we truly encourage all the residents in McHenry County to come and speak on those disabilities that we fund. So again, I thank you all very, very much for all your efforts in seeing the need to increase the funds for mental health, substance use, and intellectual developmental disabilities. Thank you.
Thank you. Gloria Foxman?
Good morning. I tried to clarify on the sign-in sheet that I'm just here if there's any questions about one of the items you're reviewing for the April 16th meeting. So the petition number, I believe, is 2024-006, and it's pertaining to the solar farm application. Just here in case you have any questions. The next person is my civil engineer, project manager. She's also here in case you have any questions.
Okay, I appreciate that. Any comments would come through being pulled off the agenda for discussion. I'm assuming if any members have questions, I'll do it at that time, but not generally back and forth between applicants.
Great,
thank you. Amy Henry, same statement? Okay, thank you, Amy. Next, we'll move on to reports and presentations. We have Joe Clark, Board of Health Chairman, and Melissa Adamson, Public Health Administrator, to give us the Department of Health Annual Report and update.
Do you want me to change the slides for you? Do you want me to introduce you, or would you like to introduce yourself? Okay.
Good morning, ladies and gentlemen. My name is Joseph Clark. I've recently been elected to serve as president for the Board of Health. Along with me today is Melissa Adamson, the administrator for the Department of Public Health. We are here to present to you our annual report. Thank you for having us and giving us the opportunity to make this presentation. We're going to start out with a little bit of background on the Board of Health to touch on some of the history and the composition of the board. If you see up on the overhead, the Board of Health was established by resolution of the county board April 12th, 1966. So tomorrow, 58-year anniversary. It is quite the history that we've had with the county. The necessity for a Board of Health or a health department is created by state statute. That's listed here. By definition in that law, it says that the board should be, every county should have a board and a health department. The board should be 12 members. And the makeup of the board should consist at a minimum of 2 physicians, 1 dentist, 1 registered nurse, and a county board liaison. The appointed members, who are appointed by the county board to serve on the Board of Health, serve a 3-year term. Next slide. Now, the current makeup of our board, just so you're familiar with what the qualifications are. We have 2 physicians, medical doctors. We need a dentist. So if anybody can convince their dentist to join the board, we're desperately in need of a dentist to serve. That's our one and only vacancy on the board.
Now, right?
We've had a number of them come and go. Seems that dentists relocate their residents often. And it's left us with vacancies. We've got 3 registered nurses. We've got our county board liaison, Ms. Altoff. We have a firefighter paramedic that serves, a non-for-profit executive director, a licensed clinical psychologist, a business owner, and woohoo, we've got a farmer. Of the board, 5 members have served more than 1 term, many more than 1 term. Next slide. By state law, the Board of Health and the Health Department has some obligations that they have to do. Number 1, what we're here for today is to present to you the annual report. Federal, state, local officials pass rules, regulations, and then mandate it down to the Health Department level for enforcement, for application. So it becomes our duty to observe the state laws for the preservation of health. We're also obligated by law to investigate infectious disease occurrences and take steps to mitigate it. We're required to do sanitary and health inspections, such as when property transfers, checking out the septic system, checking out the wells, doing restaurant inspections, et cetera, et cetera. These are all things that people mandate upon us. Authority of the Board of Health is as a Board of Health, our number one duty is to appoint an executive officer for the department. We can appoint a medical director, a physician, or we, as in the case here in McHenry County, appoint an administrator to be the executive officer over the department. The next comment is regards to duties, responsibilities, passing ordinances, hiring people, et cetera. As you all know, the health department, the Board of Health, comes under your umbrella. We, the 12 of us, in cooperation with staff, create the programs. We identify the expenses. We help write the language, from budgeting to ordinances to job descriptions, et cetera. Once we adopt it, we pass it over to you for your consideration and for your adoption to make it official county business. Now, I want to speak on behalf of all the members of the Board of Health. We notice that our county board gives us strong support. They take our suggestions, whether it be an ordinance or proclamation, resolution, budget, they review it and they adopt it. And I want you to know that the Board of Health members all notice that strong support and how much we appreciate your support. Thank you very much on that. The Department of Health is also responsible for working with other agencies, the Illinois Department of Health, the Department of Ag, different municipalities in regards to their regulations, and in a cooperative effort, administer the duties of our department. In addition to what is required of us, we choose to do some additional presentations. We interact with the public, and you're going to see this a little bit later in some of the slides, on how we reach out to the public to find out what they need, what they want, and how we can better serve them. And again, as I just previously mentioned, we recommend to you the ordinances to be adopted pertaining to health issues. And again, we're very grateful for your strong support. Okay. I'm sure you've all seen this chart before, and I'm not going to read it word for word. You can read it on your own. Our health department is broken up into 4 divisions: environmental health, veterinary public health and nursing, and administration. And you can see the responsibilities that each one of those divisions have. What I want to take a second here is to talk about some of these employees. We have someone that works for us that goes out and inspects the inside of septic tanks. We have somebody that walks through swamp water to retrieve mosquito larvae. We have somebody that crawls up into a dirty haymow of a barn to collect a dead bat. We have somebody that goes into a basement of an abandoned house to capture a stray dog that is threatening the children in the neighborhood. We have an officer that shows up at 2, 3 in the morning at somebody's tragic house fire to take custody of their dogs and cats, to give them shelter while their family tries to find out what's going to happen next. We have community health workers They show up at home visits and walk into squalor and elderly neglect and can't walk away. They have to deal with it. We have people in the records department who have to compassionately deal with a person who just lost a loved one, and now they have to work on the paperwork, the death certificate, so that they can move on with their own life. These are jobs that most of us in our society, we don't want to do. And these people come up and do it on a regular basis. They do the work that nobody else wants. These employees and the many other coworkers just like them, I wanted to take a moment to give them a shout out and say, here, here, thanks for a good job. Next one. Now the dollars and cents for the financial report. The revenue, how we pay for our services. The first thing I want to call to your attention is the 2/3 of our revenue comes from outside of the general fund. That comes from grants and fees, and et cetera. That's thanks to the financial representatives in the administration, to all the department directors and their key employees that reach out and secure funding from wherever they can so that we can offer these programs. That leaves us with less than 1/3 of our budget coming from the general fund and or property taxes. In local government, that's a pretty good accomplishment. Next. Expenses. Well, you can guess, a large percentage of our expenses is personnel. We have well over 100 people working in our department, and that captures a good percentage. But I'm identifying that here because we're going to talk a few more slides later on what is being done to try to hold down some of those costs being thankful for some public support. The next slide is on health administration. One of my things since I've been on the board I've always noticed is, oh gosh, we got more people dying in this county than being born in this county. And it's consistent month after month. Well, yes, that's how the records look. But in all actuality, you can die at any hospital or at nursing home or in your own residence in the county. But in this county, you can be born only in one hospital or a home birth. The rest of the hospitals don't have labor and delivery. So there are many residents of our county that leave and go to their OB doctor in Lake County or Cook County or Winnebago County or Walworth County. And so their birth certificate will come from their counties. So while the numbers are consistently showing more deaths in the county than births, in all actuality, we do have a pretty good balance. The language line calls. I wanted to take a second here to identify this. You can see over 16,000 contacts are made to our employees in a year's time, reaching out from the public with questions, concerns. Some of those phone calls cannot be handled because of language barriers. We have a service that we can contact so that we can communicate with those that have a foreign language that we are not familiar with. What doesn't show in this graph that I want to identify is in the last couple of years, we've had a number of employees step up to the plate and use their Spanish-speaking skills and interpretation to do one-on-one communications with the public. And that is a significant number each year. It's not listed here, but I want you to be aware that the Department of Health has done its best to try to communicate with the largest non-English speaking population in the county. Health Administration, our awareness campaign. We're not just a reactory agency, waiting for something to happen and then take action. Our 4 divisions are reaching out to the public through social media, through printed media, visits to fairs and carnivals and such to contact the public, find out what they want, to inform them what they need to know when there's an issue going on, and provide them the service that they deserve. And these are just some of the examples of the contacts that are done in a year's time. Environmental health, I'll just briefly touch on this. Our health department, environmental health, in addition to doing the inspection services that we are so familiar with, they're also out there doing recycling events. They're recycling tires and batteries and hazardous materials and paint and paper and such. All features that the public appreciates and improves our environment. They attend the county fair. They attend community fairs and represent the environmental health department very well. Animal control. One of the things I wanted to stress to you here on animal control is the positive. If you haven't yet followed the animal control Facebook page, when you get done here today, link yourself to it, like it, and follow it. They do such a wonderful job with their adoption services. The PR that this county receives based on how they present it to the public and showing the happy faces of people adopting their dog or a cat, it's wonderful, and everybody in the county should be following that. Where I talked earlier about personnel costs, animal control has 776 volunteers. They come in, clean cages, they walk the dogs, they socialize with the animals, they interact with the public. It's a great service that helps reduce our costs, and they do it just for the love of the animals. Also point out, 4,000 people came through the doors of animal control in 1 year. That is a tremendous number of people. That's just how many people that we are interacting with. And that is quite the accomplishment for the animal control department. Nursing and public health. Just a few items I'm going to mention here is for those that don't have a primary care doctor or don't have a pediatrician, they can't afford it, they don't have the insurance coverage, we're providing the vaccines for them. We're all seeing it in the news right now, the measles outbreak. We're doing the vaccines to help minimize that, so that our children don't have those type of exposures. One of the things that we keep hearing in the last year or two are the hot spots of drug overdoses, usually from fentanyl laced into some other type of bad drug. And those items are reported to us. Our staff recognizes it and goes to those areas and tries to educate, tries to offer services. Well, one of the things that we're doing is we're sending out Narcan boxes. Last year, we distributed almost 1,900 boxes of Narcan throughout the county. Before this was begun, if you walked upon a person that was unconscious from a drug overdose, you either ran to a wall phone back in the day, or you got your cell phone out, you dialed 911, you called for the paramedics. We got a person here that appears to be overdosed. Dispatch takes time, response takes time. The paramedics would get there, and they would be the first ones capable of giving the Narcan. Well, many times that was too late. Even as they did their best to get there, the time in transit was too long. Now, the police officer can do it, the school teacher can do it, the coworker can do it, the family member can do it. It's a very simple intervention that has really no downside if it wasn't a drug overdose, and can save lives. And that's something that our health division has been very proactive. In the lower right-hand corner, we talk about the breast and cervical cancer program. Again, there's women in the county that are not covered by insurance. They don't have the resources to go get the health care. So they wouldn't get it done. But because of our services, they have the opportunity. And for many of these women, as you can see from the results of their screenings, it has made a difference in their life. And it's something to acknowledge for the health division. And with that, I'll turn it over to question and answers, if you have any.
I like it. Dr. Sager?
Thank you, Chairman. I really don't have any question, but I do want to say quickly that, too many times when we think about the health department, as other agencies within the county, we think about regulation. And, I'm guilty of that as much as anybody else. I think about, inspectors going out and inspecting and regulating, if you will. But I think that you've done an exceptional job of helping us to realize today that it's really all about public service and providing services not just for individuals, but for the county as a whole. And so I want to extend my sincere gratitude to you all and your administrative efforts, the board, because you are volunteers supporting this particular effort. And so I thank you for that. And Chairman, with your permission, I'd just like this board to give your employees and all those who are volunteers for you a nice round of applause, because I think you deserve it.
Thank you, Mr. Sager.
Thank you.
Oh, I think there's other
Ms. Van Hoff?
Yes, thank you, Chair. Ditto to everything you said, Member Sager, and also, I'm just wondering if it's possible for us to get a copy of that PowerPoint presentation.
Oh, yes, absolutely.
Okay, it's in our packet?
Well,
Most of
most
it's
of
in
it
here,
is
too.
a reflection of what's in the annual report, but
Okay.
the background slides on the Board of Health are not in there, so I will give them to Kathy.
Okay, absolutely, thank you.
Thank you. Ms. Ness?
I have had 2 opportunities to interact with Board of Health employees at the request of constituents, and they have been excellent. The outcome was difficult, but it was not because of the Board of Health. Your employee who came out was exceptionally kind. It was an older constituent, very patient, came back multiple times to accommodate things going on in her life, and it was great to see that. McHenry County has always had a vibrant, engaged health department. It was something that we valued for 40 years that I've been working in this county, and it's great to see this report. Thank you. And in the coming years, I would really like to see the role and visibility of the Board of Health increased. I do, because I think we have significant health issues in this county as it relates to underinsured and uninsured people, but also just because you're the body that has its hand on the pulse of the health of this county. And I know how deep that work goes, and I'm very appreciative of it. So thank you.
Thank you.
Thank you. Ms. Wegner?
Thank you. Thank you for this presentation. I know we all can benefit from hearing everything the Board of Health does and who they assist. So I have 2 questions. Wondering, the first one is what the community health assessment that's done throughout the county, what does the Board of Health do with that information?
I'm going to defer to you.
So I guess, Kelly, can you be more specific? So we use that information to develop improvement plans. That is a collaborative effort. We work with the hospitals, we work with the mental health board, right? Based on what the data say and what the community says, we develop interventions basically to address those issues. And then we update the Board of Health on where we're at. Those are 5-year plans. We do it every 3 years because hospitals are required to do it every 3 years. The statute for the Department of Health is every 5 years, but because we do it in collaboration, we do it every 3 years. So we actually will start again here shortly.
So basically, you're just taking the pulse of the county and what the needs are and creating programs or using programs to assist those who need.
Right, and working with community. So the community health assessment and improvement plan is not necessarily everything the health department's going to do, right? But because we are required to do it as a certified local health department, it gives us the opportunity to develop initiatives, work with community and expertise that we have in this county to address the gaps that are identified.
Thank you. The second question is, I know that the health department works with other nonprofits and partners, for example, the Community Health Partnership. Just wondering if you have any idea how many partners there are in the county? Or if you could just give us an example of them.
Question for me.
Just give us an example of some of them. That would be wonderful.
So for the opioid, we work with Warp Core, Live for Lolly. We work with the Substance Abuse Coalition, just as an example. And there is a team committee that gets together to look at the data. So anytime you see an alert from us, the coroner is part of that team. So they all get together and decide what type of communication it warrants based on the situation. Again, we work with the hospitals. We have community health workers going out. We work with schools. We do vision and hearing screenings. So there's a lot of community partnerships out there. Also, our chronic disease prevention programs, that is growing rapidly. So I would expect that we would continue to increase those partnerships as well.
Okay, thanks. I just wanted everybody to hear, it's not just the health department that's doing this work. It's you are collaborating with so many different organizations in the county to get things done. Thank you.
Absolutely.
Thank you. Ms. Meshes?
Thank you. I have to echo other comments that I've had an amazing experience, and my constituents have had an amazing experience with our health department. I was wondering, so as far as the community engagement or projects to increase the health of the county, are there goals that are being kind of set for the coming year?
Yeah, so that's part of the community health assessment and improvement plan. That information, the background of the assessments, that's already posted. Groups were assigned to develop those measures and interventions. I would have to double check. I don't think that information is yet posted on our website.
Okay. And have you seen an increase or a steady amount or a decrease in the community engagement with the Board of Health and the Department of Health in the last year or so?
I'm not sure how to answer that, just because we have high community engagement. Certainly with our partners, are you talking about people? I mean, you can tell from, if you recall, the slide that showed engagement in terms of social media and people who are following. That's one way that we are measuring community engagement.
So have you seen growth? I have to go to my colleague over here has her annual report. I have to go get that and look at it. But have you been seeing growth, or is it staying kind of steady in engagement?
Yeah, I don't recall what the numbers are last year to have to go compare them, but I would say yes, because we are more proactively getting information out to targeted communities on the various social media placement. We also are, as Mr. Clark mentioned, whether it's a recycling event or farmers markets, right? We are out in the community there to provide information and make people aware of the services that are available to us.
All right, thank you.
Thank you. Ms. Althoff?
Thank you. I just want to add to the, it's not just community engagement, it's also engagement with other departments of public health as well as the state of Illinois and all the requirements now we have to collect data and provide that. So there's one kind of central depository, so to speak, about the health of the state of Illinois as well. It's not just McHenry County. Disease travels, dogs travel, People travel, people have babies in different counties, live in McHenry County. So all of that is extraordinarily important too. And what you've seen a lot is us bringing forward information and additional costs because we're required by statute to provide this information back and forth between agencies, units, agencies. So thank you. You guys do a phenomenal job.
Well, and our colleagues too, we do a lot of cross-departmental work with our colleagues here in the county, so.
Great. Seeing no further questions or comments, thanks, Joe, for coming. Thanks,
you.
Melissa, for answering questions.
Thank you. Thank you.
Okay, we'll move on to new business. Do any members have items from next Tuesday's agenda they'd like to remove for discussion? Going once, going twice. Seeing none. Pete, you got a report for us today? Oh, you got a spoiler in the crowd. Mr. Kearns.
I just wanted to pull on the zoning, the 10A5 and 10A7, not to pull it off of the meeting. I just want to make sure I register as a no vote because of my opposition to the unlimited timeframes on them. And I don't necessarily have to have a discussion, but I just don't believe in this state law that has changed our zoning. 16B27, I would like to just discuss, I don't want to discuss it, I'd like some explanations and clarifications.
Okay. Anyone else? Seeing none, does anybody have any comments on 10A5 or 10A7? Seeing none, we'll move on to 16B27, Jim. Go ahead.
Okay, just note when you read through this and you look at the, because of the, I got the right one, this is the fiscal, the 25 board approved budget policy coming forward. My questions were just to ask, when we change the levy amount of the fund, reducing it down to the $62,998 from this year's $73,973 million. And that is because of the mental health reduction. One question on that is that now locks our P-TEL into $62,998,000. Is that correct, Pete?
No, I would, you're half right. I think we would take it down to that base 62 whatever million. Though I think we would allow ourselves, and we would talk about a growth of the CPI, which I think is set by the state this year at 3.4%. So we would, that's my interpretation.
Right, but that's based off of the 62 million then?
Correct.
In the future? Yeah, okay. So we could take it up by the CPI of the 3.4.
Plus new
So it's
growth.
not on the 73, it's on the 62.
Correct. I mean, that's what this says. And I think
Okay.
that is I'm not going to get into the legal machinations that are what you could.
No, I just wanted to make that up to clarify for when we have these debates later on in the year. The other ones I wanted to note was the red lines, some of the changes and subtractions in those deletions. One, I don't know if we've ever had what departments are off of each fund, the red lines that are added there. That would be on page 17, Exhibit B. That's just an addition, right?
So in last year's policy, there was something similar to this, but this is actually pulled directly from the budget document. So I think through the course of some of the conversations last year, it would be helpful to see which departments belong to which funds, and then a short little description. So it's really just expanding on what was on there last year.
And thank you for that. I like that a lot. That's one comment I wanted to make on that. So were there any deletions, the crossed out red lines? Was there any particular reason for those or changes? I know like in the financial strength, we took out that wording, are viable by establishing the following budget directives. Is there
does that actually affect anything by removing that?
No, some of the stuff we were just trying to clean up some old language.
All right. No, that's all I had. Thank you. I like it. Well done.
Okay, seeing no further comment. Pete, you got a report for us today?
Yeah, a couple of things quick. Scott and I and Joe Terrio and IT and facilities, we were able to tour the new election center earlier this week, and it's kind of exciting to see how that's coming along. And fair to say we're about on schedule. Yeah, you stayed longer than I did, but I mean, it's all the coolers are out, so the space looks really big now, and it's exciting. I received in the mail the quarterly newsletter from MySeco, and I don't know how many of you guys get this mailed to you. I didn't see a lot in the mailboxes here, but you can sign up for this. But I was reminded, Joe McCoy, the director, is reminding you that there are a handful of committees that he's welcoming participation on. Pam and I had an opportunity. I serve on one of the law and justice type committees, and we had a meeting a week ago Friday. Had representatives on there from DePage and Will and Kane, and there is interesting opportunities. If anybody wants to serve on those committees, let me know, or you can shoot Joe McCoy an email. But I'm happy to coordinate that. Wanted to acknowledge that end of last week, Suzanne Ziebert from the HR department emailed out a request for your participation in my evaluation, and it would like to get those back by I guess 2 weeks from tomorrow. So we appreciate your input on that. Reminding that whatever you put in those emails is only going to Human Resources and Joe Godemaller. I'm not going to see that until Joe puts everything together, but it's always good to get your input on what can we do better next year, and particularly what are some of the goals you'd like to see for my position next year. Wanted to acknowledge that Pam was in Springfield yesterday with Alicia, and Alicia stayed overnight and went to a reception, so she's en route right now, but then he got a pretty good day down there. Pam, it looked like Alicia was proud to send a lot of pictures, so.
She does like her pictures. And please note, I'm hardly in any of them. Thank you very much. It was a good day, and just to give you guys a little bit of an update, there was a huge amount of conversation about two issues in particular at the county level. One of them obviously being solar and wind. There's a great deal of effort from all counties throughout the state of Illinois, and let me tell you, it is perceived differently in the north than it is in the south, and vice versa. But we did have some very positive meetings about items that we would like to put in a piece of legislation that we would introduce at the kind of the end of this spring session, discuss with all of the stakeholders throughout the summer, and then hopefully get consensus at the veto session. And so if you again have any specific issues, one of the large ones that everybody does agree on is an issue that Board Member Kearns brought up, which is the availability to reassess or reevaluate periodically the cost of decommissioning, and giving the county a little bit more authority to ensure that we have the financial wherewithal in which to deal with those issues. And the other one was staffing issues at county-owned nursing homes, and the significant penalties that are being considered by the state and placing penalties on county-run nursing homes who don't meet staffing requirements. And so that's a big issue that I think that will come probably and will be dealt with, I believe, Chairman Meshes, through your committee. But those were the two issues that throughout the state of Illinois, all counties are grappling with. So.
Thank you. Yeah. So yesterday was like basically a county lobby day all day yesterday, and Joe McCoy and the ISICO staff did a good job of putting that together. Yep. Okay. And next week is going to be kind of the IML lobbying day, and Shaylin will be going down with Chairman Bueller and working arm in arm with our mayors down there, and again showing how good the county works with our municipalities. So that'll be middle of next week. This afternoon, along with Adam, we're having a meeting with Comcast to kind of get an update on where Comcast is with all this state fiber money and federal fiber money. And, we've been frustrated, as we shared, with the pace with which the state is kind of out making these allocations. So we're going to get their perspective on updates on there. So looking forward to hearing from Comcast this afternoon. And we got 3 events coming up in May. I guess we've touched on a couple already, but May 9th, we're going to have the mental health open house at 5, or town hall, I guess we're going to do that. But also on May 9th, after Finance Committee, that's part of the Public Employee Appreciation Week, and we're going to have kind of our annual picnic for employees. So you're all welcome and encouraged to come out. It'll be like 11 to 1, 1:30. We've done it outside the last couple of years. I think we're going to do it in this room this year. It's going to be, I think, a taco bar or something like that. So if you want to serve cheese and lettuce, you come on in. Yeah. But we're going to keep people in a little bit tighter. So we'll do that on May 9th. And then also in May, on May 19th, that's a Sunday, from 11 to 3, our DOT will be having a Touch-a-Truck event at the Farm and Fleet in Woodstock, and this will be the first time they're doing that. So we'll get all this information out to you in other communications, but just get those on your calendar. Thank you.
And are we still tentatively May 6th for the RPC, that 2050 plan open house, and the 13th for the public hearing?
Yes. We are on the 6th, but the 13th was bumped to the 16th is what we're looking at, which would fall in line. It would be a Thursday, which would fall in line with the regular meeting schedule for the RPC.
Thanks. Thank you. All right, with that, I'll entertain a motion to adjourn. Mr. Scholar makes the motion. Ms. Altoff seconds. All in favor, say aye.